One of the Construction Innovation Hub's research projects is exploring service innovation at two smart hospitals, Moorfields Eye Hospital in London and Sheba Medical Centre in Tel Aviv.
So Moorfields Eye Hospital is one of the top eye hospitals in London and across the world, actually. They have been at the forefront of innovation even before the pandemic. And so you could say that innovation had always been an integral part of their DNA.
But implementing innovation requires the right people to be in the right roles.
And in fact, they had set up an innovation hub and appointed a director of innovation too, in anticipation of a new smart hospital that they had been working towards.
The readiness was there to really scale very quickly with the infrastructure that they had. And so it was with the preparation, both in terms of the different prototypes and experiments that they had been running, the virtual clinics, as well as setting in place organizationally a director of telemedicine and a director of AI, and very recently a CCIO, which really helped to focus the resources and the ability through the pandemic to accelerate and redesign through video consults to be very effective in handling contactless care throughout the pandemic, particularly in the area of emergency A&E, where many people, where the first trial was really scaled. Within about 3 months, they went from 0 to 10,000 video consults, which was staggering and way beyond what they could ever have anticipated or dreamed.
With the implementation of telemedicine, hospitals like Moorfields began to experiment with remote consultations. But is this a replacement for in-person visits to the doctor?
Prior to this innovation, the first point of contact would usually be that physical consultation between a patient and a clinician, where you would have a full eye examination. With this innovation, however, a patient can now first go online. They would then be put in a virtual reception and waiting room. A clinician will then go there to find them. They would be able to talk about their history of their illnesses and their conditions, as well as other aspects of a virtual consultation that they would go through. Red flags and safety netting procedures would be there to help them out, such that if it is deemed that a patient needs a physical consultation beyond the initial virtual triage, they would then be recommended to go into the hospital, into the A&E service itself for the physical consultation. So if anything, it's a new stage to the service provision instead of replacing the old physical consultation, which is still there for the more urgent and important cases.
Can virtual appointments help with the waiting list for physical consultations?
Funnily enough, though, we did come across this instance where, because physical queues were still quite long at times during COVID, and it seemed like not everyone was so urgent in their conditions. Some patients were asked to perhaps step away from the physical queue into a virtual queue for a virtual consultation, which they did. So this is the beginning of how a future Moorfields service could look like, and they're still trying that out.
They weren't necessarily specific solutions that already existed. And so they had to take the technology they had access to, adapt it to the kind of environment they anticipated, but importantly also adapt on the go. Because once they put something in place, learning how patients reacted to a new environment, as well as how staff needed to work with the new tools. So staff needed to be protected themselves from the pandemic, but also needed to ensure that they weren't endangering patients themselves. So they needed to change systems, install new systems, to take care of patients, but at the same time be as effective as possible for the care of patients.
Sheba Medical Center is the largest hospital in Israel and in the Middle East. It is ranked as one of the 10 best hospitals in the world by Newsweek, and also one of the smart hospitals of the world. And one of their drivers of innovation is that they created an innovation hub within the hospital, working closely with the industry of startups within the hospital. The innovation center is called ARC, which stands for Acceleration, Redesign, and Collaboration. And they really use this model, this concept, before the pandemic, but it really was a proof of concept during the pandemic, where they accelerated their technologies that are already developed. So Sheba Hospital developed an emergency hospital in an underground parking structure that was originally designed as an emergency hospital for times of war. And they reconfigured the space of the underground parking and divided the unit into two zones. A contaminated zone where the patients with COVID were admitted, were hospitalized, and the staff had to wear the full PPE, the protective equipment gear, and a clean area, a clean zone where they created a control room with different technologies, digital technologies, to remotely monitor, supervise, and communicate with the patients and with the staff working in the contaminated zone. And this model actually provided them to safeguard the staff. So only the limited number of necessary staff were working with the patients in their bedside with the protective gear. And most of the staff were supporting them from the control room using remote technologies. And it was also a technology that was supportive of their operations, of the way they managed the unit and how the teams communicated and supported each other. Interesting is that they didn't only accelerated their telemedicine technologies that they already had developed before the pandemic, they also used it for inpatient care. They designed new units for COVID patients, implemented remote healthcare for inpatient hospitalization.
The use of robotics was really cool, and indeed was seen to be many ways the most humane of the caregivers, because the robot had a screen which showed the person, whereas other clinicians had on the PPE garments which hid a lot and obscured their faces. So it was a fascinating way in which digital technologies, which were around before the pandemic, were brought into a new situation and scaled up for actual operational use.
And this new model really showed how you can use telemedicine technologies for very diverse purposes. So it's not only to communicate with the patient at home, but also to communicate with staff working in different areas in the hospital, communication with experts, medical experts, and also allowing even the patients to communicate with their family members who were not able to visit them in the hospital.